morning. I'm delighted to be here. I couldn't be more excited that this group has come together. I totally believe that the cost of medications is too high and it's only projected to get worse. For those of you who don't know who I am, I'm State Representative Rob Nosse. I represent House District 42, which is southeast and a little sliver of northeast Portland. And some of the most gut-wrenching days in this building for members of the healthcare many who are with me here, are when people come and literally spill out their purses and their shopping bags with the various medications that they need to take to stay alive, to function as parents, to go to work, and then they describe the struggles that they face to afford them and the trade-offs they make in that process. They're almost always working class and middle class people who yearn to be productive members of our state, who desire to contribute, but they lack jobs with either good health insurance or they're on exchange plans with very high deductibles and hefty cost-sharing mechanisms once their insurance benefit actually kicks in. The problem was really well illustrated, I think, by a story about Gloria Rogers in the most recent Portland Business Journal. When Gloria was 4.5, she was diagnosed with a rare genetic mutation that caused seizures. She was hospitalized for 2 weeks, but her condition continued to deteriorate and she lost the ability to eat by mouth. She was airlifted to Portland. Doctors diagnosed her with an infantile spasm and prescribed, I hope I'm saying this right, Cathar, a frontline treatment for the syndrome. Now there was only one problem. The drug cost $35,000 a vial. Now at first, her parents, who are not super experienced with the medical field, thought that this was some sort of new experimental treatment, that it was just invented. In fact, the drug has been around since the 1950s. It's been off patent, and in 2001, Cathar Pharmaceuticals bought the rights to Cathar, which at that time cost $40 a vial. They raised the price, I hope I'm saying this correctly, 85,000%. Now, most of you are also familiar with the EpiPen and their 500% price increase. However, insulin in this country has been increased by 300%. We have the most expensive insulin on the planet. Duthyx, I hope I'm saying that right, it's an arthritis medication. It's a combination of ibuprofen and Pepcid, both which can be purchased over the counter. They've increased their price by 1,100%. And if you go on a KGW website, they have a great public infographic that shows 100 drugs that have averaged over a 400% price increase since 2012. Now, healthcare providers in this state have been trying to keep healthcare costs reasonable, but they can't do it if the pharmaceutical industry does not change the way they price medications. I think some of you know that I've led a work group on high-cost prescription drugs that started meeting in August of last year and met monthly for almost a year and a half. Coming out of that work group is a bill that I would encourage all of you to look at, House Bill 2387. The bill contains 3 core elements that help to keep prescription drugs more affordable to consumers. It lowers out-of-pocket copay costs to patients. It requires pharmaceutical manufacturers to explain their costs to the Department of Consumer and Business Services, our state agency, for drugs that cost more than $10,000 a year, or ones where they increase the price by more than 3.4% over a year's time of medical inflation. That's the trend number that we've been using in this state to try to hold costs down to. It also requires those same drug manufacturers to tell our DCBS how much they are giving out in our state with regard to coupons and patient assistance and who gets them and for which drugs. Finally, there are 2 required rebates to insurance plans in the bill. One of them probably needs to be amended out as we think it's too difficult to implement. The one I want to focus on here today is one that asks us to take an average of what is charged among the member nations of the OECD, that stands for Organization of Economic Cooperation and Development. They're among the 35 most industrialized, richest economies in the world. And take an average of a prescription cost in those nations, and if what is charged in Oregon is greater than that average, it'll be offered as a rebate to the insurance carrier, and that in turn will help keep rates low. Now we're going to sweep PEB and OEB and other small group plans that DCBS regulates into this. Anything that the state of Oregon can legally legislate around, we're going to sweep them into this as well.